Let's talk about what to do if your epidural fails. You should not be feeling that amount of pain for a long period of time if you have a functioning epidural. That is not to say that you are not going to feel anything with your epidural. In fact, I encourage you to tailor your epidural to where you can still move your lower limbs, but you're not feeling a lot of pain. And we can do that using the epidural pump. So let's say you are feeling more than you want to feel and you tell your nurse and she checks you out. A lot of times they'll use an alcohol wipe to see where on your body that epidural level is. And she notices that it maybe just isn't working as well. What do you do then? Let's say she calls anesthesia and they're just like, oh, it's pressure, not pain. Tell your nurse that you want to see the anesthesiologist in your room. Now, they may be in with a C-section. You may have to wait a little bit of time, but you are paying hourly on that epidural and you deserve to see them if it is not working. If they are kind of putting it off or whatever, which I have seen as a labor and delivery nurse, you want to be very clear that you need to see the anesthesiologist in your room ASAP, stat, if you will. Remember, you get to tailor your epidural to you. They are paying an hourly fee, which means sometimes you can go up, sometimes you can go down. I love a very heavy epidural in the beginning so that you can get a nice nap, and then maybe we tailor it off a little bit so you can move a little bit more and feel when as baby's descending and you're more able to push. We have tips like this and more in the online prenatal class for couples, so come join me.